she's going to spend a little bit of time talking to you about what she's been able to accomplish and just give us some great information today. So,
Beautiful Iowa. Moving forward.
she was also, I missed that part. 2012, she was the Iowa governor candidate. So that's for the Libertarian Party. That's fantastic. So, without further ado, welcome, Dr.
Well, thank you very much. Now, there is one thing you left out I am kind of proud of. I have to tell you this. I was banned in Boston.
Yes.
Okay.
On the list.
Yeah, if you remember Citizens United movie, the Hillary the movie, I was actually in that movie, so when it was banned in Boston, I was proud to say I was banned in Boston. I'm actually very honored to be here. Thank you, Mr. Demarest, for thinking of me and the Nebraska Libertarians. You guys are awesome, and I give you credit for the most effective and efficient business meeting I've ever sat. That's pretty darn impressive. Now, I have to say one thing. We have one other candidate with me, Jake Porter's here today. Jake ran for Secretary of State. And I just want to tell you, I know we get sometimes frustrated as libertarians like we're beating our head against the wall, but here's the point. I mean, Jake didn't win the seat. He got over 30,000 statewide votes, but he ran a great campaign, and the point is his ideas are being used by the current Secretary of State. And all over Iowa, we hear people now saying, you know, I might be a libertarian. So we're on the move. One of the great things we accomplished last election cycle, and Jake led this charge, was we almost put the lights out of Iowa Public TV. They've dimmed considerably, and they're still dimming because people are not given the money because, you know, we pointed out that they're not what they pretend to be. You know, they take 50% of their income from the taxes that are in their so-called education fund. But you know, when they wouldn't let us debate, people started realizing they're really not about education. And so now they're not getting the funding, and so I think that's great. Actually, they hired a PR person because we shut their phone lines down several times. They hired a PR person, but clearly their problem is not PR. Their problem is principle. You know. So anyway, I appreciate being here today, and I'm here to talk to you technically about Obamacare. But I'm going to tell you up front, Obamacare is not fundamentally different than Medicare. Obamacare is Medicare on steroids. You know, they're both going to get us to the same place. This was just designed to get us there quicker. And in fact, that is one fundamental difference. You know, the architects of Medicare, when they brought in Medicare in 1964, Lyndon Johnson, I think in 65, signed the Medicare Authorization Act. But they did it by stealth. They claimed, oh no, we're not here to get in the way of the doctor-patient relationship. We're not here to regulate medicine, of course. We're here just to help seniors pay for their health care. Well, that was a lie because almost 70% of people at the time, over the age of 65, had private health insurance, and they didn't want to get rid of it. So the government had to use force and had to make it illegal for private insurance to sell these people insurance at that age in order to make this whole system work. So they did it by stealth. Now, the difference today is the architects of Obamacare make no bones about it. They want to bring us single-party, universal health care system, Canadian style. And I'm going to apologize. I have two good friends here, Larry and Laura, both good conservatives. But Laura, who was I think she was like National Canadian Athlete of the Year several years. I think she swam the Great Lakes to come here, and she's now a newly minted American citizen from Canada. So, I'm sort of on the health care system, so this is not about Canada in general. So anyway, yeah. So they really want single-party payer. Now they want government-run health care. And it just drives me crazy. This is one of the problems. Where we stepped across the constitutional and ethical line was in 1965. That's why it's kind of a little bit hard to take the Republicans seriously when they say, you know, they're all upset about the constitutionality of Obamacare, because every year they vote for the Medicare, Act. My own congressman, Steve King, Republican, claims to have his Constitution next to his heart all the time, and he whips it out, and he has it in his coat pocket, and he brings it out and says he keeps it close to his heart. And I always want to say, Steve, why don't you read that thing? Because there is no enumerated power given to the federal government to get involved in health care. So when you say repeal and replace, we don't want you to replace. We just want you to repeal. Now, here's a pop quiz. Nobody that knows me can answer. What was the first place that enacted government-run health care, and for what reason? Anybody know? Okay, well, it was Kaiser Wilhelm's Germany in 1871. And here's the story. The Kaiser was being threatened by the Social Democrats. And so they wanted to overthrow the monarchy. And Kaiser Wilhelm's advisors said, Kaiser, you got to give the people something. Oh, we know, give them health care, because if they're beholden to you for their very health, they're not going to overthrow the monarchy, right? So it was done for power. and I would opine that's what it's all about today. But it was done for power, and it worked fabulously for about 40 years until the money ran out. So that was the original thing. Now, there are 3 reasons that government always gives for getting involved in healthcare. And it's the same 3 reasons whether you look at the Soviet Union, you look at Canada, England, or us. And the first one is access. I mean, that's the one that we kept hearing the drum being pounded for Obamacare. We have to have better access. Well, it turns out, you know, when they really looked at it here, there were about 15% of people that were uninsured at the time. And by the way, keep in mind, insurance does not equate to medical care. Okay, it's really, those are 2 different things. This is like, if you destroy the system that delivers medicine, if you destroy medical care, and then you give you free insurance, how has that helped you? That's like giving you a free parking pass to a parking lot you just dropped a bomb on. I mean, that doesn't really help you. So those 2 things are different. But in any case, access. So it turns out in any system you devise, there are about 15% of people that fall through the cracks. I mean, I was in the Navy for a number of years, and the joke used to be there were 10% that didn't get the word. It was probably 15%. In British Columbia today, I just happen to know the numbers. You know, in Canada, it's a universal healthcare system, but it goes by province. In British Columbia today, 15% of people are uninsured. How can that be? It's universal healthcare, government run, right? Well, because they live under a bridge. They don't have a fixed address. They don't pay taxes. They're not a citizen. Or they just didn't sign up. You know, there's, even in free systems, people just don't avail themselves of it. So there's always people that fall through the cracks. That's just the way it is. That's access. Now, quality. The other thing they want to tell you is we need somehow this bureaucrat 2,000 miles from the point of service is going to improve quality. I'm not sure how he thinks he's going to do that, but they think they can. Here's all you need to know about quality, and that is, if government-run universal health care was so great, why have we caught 2 former premiers of Canada, a whole bunch of bigwigs, and most interestingly, most recently, the former head of the National Health Service sneaking across the border in the dark of night to come to America for their health care, right? That's a fair question. And you know, in fact, Danny Williams, I think he was a former premier. I don't think he's there now, but he was the premier at the time of Nova Scotia or Newfoundland or something. And he said when he got caught, because he had a heart problem, and he came across, I think he was in Massachusetts, and he got caught, he said, yeah, but this is me and this is my heart. I need the very best. Let me translate that for you. You gray masses get what I give you, but I'm a political class and I have to have the very best. That's the way it's going to be in Obamacare and everything else. I mean, look, Hillary Clinton is not going to stand in line waiting for emergency care like you and I will. You know, when Boris Yeltsin needed his heart surgery, what did he do? Did he go to the hospitals he set up for his gray masses? No, no, no. The Soviet citizens, you guys get one thing, but I go to a hospital. He went to a hospital only for the Politburo. He had 2 American-trained surgeons operate on him, but even then, he knew that they might want to kill him because in the Soviet Union, you know, heart surgeons got paid less than bus drivers. And so he hired, God love him, Dr. DeBakey from Texas, who was 92 or something at the time, flew over and supervised his surgery. That's what you do when you're a political class. You know, the Sultan of Brunei, when he needed his cancer care, where did he go? He didn't go to France or England or any of the darlings of the socialist set, right? He came to MD Anderson in Texas. I know because my friend took care of him. Now here's a guy that can afford to go anywhere in the world, but he knew his life depended on it. He came here. In fact, if you look around the world today, 20% better outcomes, 20% better survivability. If you're a man, your 5-year survival of cancer in America is about 65%. In Europe, it's 46%. In England, it's 45%. It's not good. It's 20% difference, so who are you going to call? So that's quality. Now the third one, I can barely say with a straight face. So access, quality, the third reason that governments always give is cost containment. When has the government ever come into your business and made you more cost effective? I mean, it never does. The same principle that brought us the $900 military toilet seat is bringing us the $30 medical aspirin. And what is that? Well, in the military it's called mil-spec. We all know it doesn't take $900 to build a toilet seat, right? It probably takes $5 or less. But if you add on pages and pages and pages of military specification, suddenly the price goes up. And that is exactly the same thing we have in medicine today. You know, before we had Obamacare, we had 160,000 pages of Medicare regulation that carry the force of law. And now we have, on top of that, 2,300, Obamacare started out at 2,300 pages. It's now, who knows what, 10,000, you know. I mean, by the Constitution, only Congress can make laws, but it turns out the Health and Human Services is cranking out these regulations, and they carry the force of law. I mean, they put doctors in jail. Now, think about this whole thing. We have a tax code, right? Now, this Medicare regulation, this medical care regulation, is 3 times now the length of the tax code. Ask your attorney, do you understand the tax code? And he'll say, oh no, oh hell no, I don't understand. He said, you got to have a tax attorney. Well, guess what? I have a tax attorney. And he says he didn't understand the tax code. He says it's spurious, we just have to wait and see what they do. And that's the problem when you violate the rule of law. It's no longer that I can go to court and argue my case. It's just whatever these bureaucrats say the truth is that year. Now, we have an example of this. If you don't think this is serious for the medical profession, we have doctors in federal penitentiary. One of them that just got out, he was there for 18 months. And this should be a chilling tale to all of you, whatever business you're in. He got put into federal penitentiary because they claimed he falsified a document used to bill Medicare. That document was an operative report. Now, it turned out he had underbilled Medicare, so there's no way that they could get him for fraud, for overcharging Medicare. They just didn't agree with something he put in the operative report. Now, he had surgeons on his side testified, no, it's completely legit. What did these bureaucrats know? That's a pretty scary thing. They wanted to get him, they got him. You know, and that can apply. So if you're a plumber, you do something for the government, they can use this principle now against any of us. So this is a pretty bad thing. Well, let me just tell you, I'm going to put this all together. Access, quality, cost. These are the arguments they make for government and healthcare. Let me tell you an example of how the government makes all of these things worse. Now, I had the unfortunate experience one time to have to actually debate a true Marxist on the John Stossel show. I was kind of thrown in unprepared, and you know, they just, every time I would say something, he'd say, that's just an anecdote. That's an anecdote. Well, you know, you get enough anecdote, you can call it what you will. I call this an exemplar because it exemplifies everything wrong with government health care. But the bottom line is you put enough anecdotes together, and pretty soon you've got a pattern here, right? It's like Stalin said, you shoot one person, that's a tragedy. Shoot 1 million, that's a statistic. Now, okay, so there used to be, there is a test. It's called the Doppler ultrasound. And the Doppler ultrasound is a very important test that we do to check to see if you have a blood clot in your leg. You know, if somebody's sick in the hospital and their leg starts swelling, they can die from a pulmonary embolism quickly. So this is a test we need to do effectively, efficiently, get it done and treat you. Well, the way it used to work was, nurse would call me from the ward, she'd say, hey, Joe Blow has a swollen leg. I said, fine, wheel him down to x-ray, and we'll have the specially trained ultrasound tech do the test. It would take about 15 minutes. And then a board-certified radiologist would call me within an hour and tell me, yes, there's a blood clot, no, there's no blood clot, or it's an indeterminate test, we have to repeat it, or it's bad quality. So there's already inbred quality controls here. And for that, the government paid $236. Medicare paid us $236. Now, enter an unelected government bureaucrat. I don't know what the thinking was. I don't know what the reason was behind this one little regulation. But this is what they said. They said, okay, now, we don't think of these ultrasound techs who have been doing this test successfully for 30 years should be allowed to do it unless they have a new special certification just for Doppler ultrasound. So my hospital called up and said, well, what does this involve? They said, oh, it takes 2 years to get this certification. Okay, now what did this do? Well, you know, in Iowa, and I'm sure this is true in Nebraska, I'm sure this happens to you guys too. We have 118 hospitals, but 88 of them are small rural hospitals with one ultrasound tech, none of whom was licensed in this new certification. So, now what happened? Well, what happened is now you had somebody with a swollen leg on the ward. They call you, first of all, now you can't do the test. So we have to spend an hour or two calling around to find some hospital that can do the test. Once we identify that, we have to call an ambulance crew, and you, hopefully you're not too sick, because we're going to bundle you up and drive you all over hell to another hospital with an ambulance crew that may be highly qualified for what they do, but they're not supposed to be taking care of ICU patients. But that's what this comes down to. So sick patients in on an ambulance, go to another radiology suite, you lay around there for a while. If we're lucky, and you survive all this, and we get the test, and you get back into your own bed, I might get the result in 8 or 9 hours. That's how long it took the first time I had to do that. So what has this done to, you know, these three things, access, quality, and cost? Well, let's talk about quality first. Clearly, it has blown quality out the window. Delay in care, and the risk of transporting sick patients around. I mean, you know, the government recognizes that any time I put anybody into an ambulance for any reason, I have to permit them for death, because there's a certain finite increased risk of death in an ambulance. I mean, that just happens. Sick people, motor vehicle accidents, whatever. So quality's out the window. What's it done to cost? Okay, remember the test used to cost $236? Well, I talked to the ambulance crew chief that did the billing. I said, how much is this now adding? He said, minimum cost addition is $3,500. So now we have a test that should be $236, is now $3,736. As a taxpayer, I am totally offended by that, and you should be too. I mean, this is unbelievable. Now keep in mind, we have 170, 180,000 pages of regulation. This is just one of them. But here's the kicker, okay? Remember how we heard we got to have Obamacare, we got to have better access to health care. What did this do to access? Well, clearly it got rid of, if you're a Medicare patient now, this is a Medicare regulation, clearly you don't have access to care like you did. But how about you? You might be paying $700 a month for your Blue Cross Blue Shield. Or, better than that, let's say Warren Buffett, the Wizard of Omaha, wanders into my small Iowa hospital and has a swollen leg. He says, no, don't send me anywhere. I'll pay cash for the test. In fact, I'll even donate $1 million to fix up your little shabby ER here. And we have to say, sorry, Warren, we talked to the Medicare bureaucrats, we can't take your money. Oh, we can't take this guy's Blue Cross Blue Shield, which he's paid in good faith and should get the study for. And you know what? We can't even take care of the poor person for free because, according to Medicare, this would be discriminatory against Medicare patients. But that is government medicine in a nutshell. More costly, more convoluted, less access to care, and bad quality. Other than that, have a nice day. Now, if you think this is the worst, sadly, this is not the worst. The worst thing is what government medicine does to the ethics of society and to the ethics of my profession as a physician. Okay? Well, first of all, what's it do to society? This is cut it however you will. Government-run healthcare is a system based on theft. Nobody would think, I don't think you would. I mean, I know we're libertarians, of course we wouldn't, but I think even in another party's meeting, if I said, do you think it's moral to put a gun to your neighbor's head and force him to pay for the car payment of the gal down the street, he'd say, no, that's not a moral act. Well, is it any more moral if you put a gun to your neighbor's head and force him to pay for this lady's medical care, broken head? And how about if we use the IRS instead of a gun? No, it's not more moral. This is a system based on theft. And it pits one class of people against others. It pits, we hear these stories elsewhere where young people are offended because their tax dollars are going to pay for somebody else and they're not getting their fair share of the medical dollars. That's what happens. It's a terrible situation. But what does it do to medical care? Well, unfortunately, the truth is, medical care, call me old-fashioned. I think medical care, my dad was a small-town country doctor, I'm a physician, my son's a physician. I kind of thought that medical care was between a doctor and a patient, not between a doctor and a government bureaucrat and a patient, but that's the old paradigm, I guess. But, we create medical care. It's a doctor and a patient. It's not the government. The government doesn't create anything, it just redistributes. So how does it redistribute medical care? Well, it does it worldwide, no matter where you look. This is how they do it. They do it on the basis of the utilitarian ethic. And the utilitarian ethic is really an evil philosophy that came to us from Plato to Kant to Hegel to the Prussian education system and thence to America. And what it says is that, that society should rationally allocate its resources to provide the greatest good for the greatest number of people. Now, that sounds pretty good. Superficially, that sounds pretty good. I mean, who would want to be irrational in allocation of resources, right? Rational allocation of resources, how can that be bad? How can it be bad to do the greatest good for the greatest number of people? Well, it's not a problem when this is applied to industry. If I'm a light bulb manufacturer and nobody's buying 40-watt light bulbs, what do? I reallocate my resources to the 100-watt light bulb, production line. That's perfectly ethical. What's it mean when I do this to medicine? It means I, the government, decide we're not going to treat this disease, we're going to treat this disease. And then it goes to, oh, we're not going to treat this group of people, we're going to treat this group of people. In fact, maybe we'll just let these people die so we can afford to do these people. And in the extreme, it becomes, we're going to kill these people so we can take care of these people. And I will tell you that no matter where you look, if you look long enough, if systems are in place long enough, they always end in a culture of death. I'm not kill yourself because you're terminally ill. I'm a libertarian. Your body's your own. But we have to look here at what the goal of the physician is, what your role as a physician is. You want to know that when you go in to see your doctor, he's acting in your best interest, not trying to rationally allocate resources away from you to somebody else. You know, that's, and Hippocrates said in the oath, which nobody takes anymore, he said, you know, when I enter into the house of the patient, I will do so only for the good of the patient. Because he recognized that there's always a third party whispering in the doctor's ear that may want to kill you. You know, your wife might want your insurance, your business partner might want your business, or government might want you to save money. So you don't want a doctor working for the government, you want a doctor working for you. And we have a long history that looks at this. You know, it's really easy and I'll back up and say I have two sons in their 20s, and they grew up in this generation that believes that if anybody mentions the Nazis or the Soviets, they're crazy. So excuse me for being crazy, but I like history, and I think there's a lot we can learn from these places. It's very easy to discount the German doctors in World War II, the Nazi doctors, and say they were a bunch of madmen and terrible people, and they were just nuts. That turns out not to be true. These were the university boys. Dr. Death, the guy that was so famous for the Mengele, that was so famous in Auschwitz, he actually was an MD, PhD, and he was doing his stuff at Auschwitz under the guise of the Kaiser Wilhelm Gesellschaft. That would be like a Department of Medicine. That would kind of be like UNMC running Auschwitz. You know, this is really what went on. Well, I have to tell you about how this worked. Now, here's what happened. Well, let me just back up and say, when it comes down to determining who gets what do governments do? Well, there are two people that they always support. They support the taxpayer and the warfighter. So if you look, there's always the young people get medical care, and the people on the fringes, there are groups that always get devalued. Children with disabilities, the very young, the very old, the disabled, the psychiatric patients, the terminally ill. These patients are not, these are the people that they don't want to support medically. Now, that's what, in World War II, before we saw the concentration camps, really, what we actually saw was a euthanasia program set up to allow the kind of semi-voluntary death of the people that weren't contributing to the war effort. Now, when the Germans marched into Holland, if you don't think this is a story coming here, let me just tell you the historical perspective here. When the Germans marched into Holland in 1941 or 42, they told the Dutch doctors, hey, now you're part of the Third Reich and you have to be part of our medical system. And the Dutch doctors were horrified. They said, no, we're private contracted with our patients. We don't do this. We don't work for the government. And by the way, these are our friends, our neighbors, our relatives. We are not going to send their records off to your euthanasia boards. We're just not going to do that. Well, the Germans said, you must do that or we're going to take away your medical license. Boom, no problem. 100% of the Dutch doctors in 1942 surrendered their medical licenses rather than work under the Nazis. It was probably one of the most principled acts of World War II. But let's fast forward to today. Today, after 2000, euthanasia is legal in the Netherlands. Why? Because the government owns all health care and they devalue the lives of the children with disabilities, the elderly, the infirm, etc. I hate to say it, but death is the cheapest alternative. Now, if you look at the numbers, and I will cite, Wesley Smith is really an expert on this. He wrote a book called Forced Exit. Wesley Smith's numbers say, if you're under the age of 10 in the Netherlands today, the #1 reason for death is at the hands of your doctor. 30% of pediatricians admit to euthanizing children. I mean, this is a pathetic statistic. 30% of pediatricians admit to euthanizing children. And they tell you they're not always honest about it on the death certificate, and when they looked at the euthanasia program in the Netherlands in general, they're not always honest about it with the families. In other words, they could be euthanizing grandma and you don't know. Okay, so that's a pretty sad statistic. And what's happened is there's kind of a pushback. This is a little amusing. There's kind of a pushback to all this happening in the Netherlands because the Dutch doctors, who are in fact the grandchildren and children of the principal doctors in World War II, are saying, well, wait a minute, we kind of didn't expect it to go this way, and we're not sure we want to keep doing this euthanasia thing. And so in response, because the government still wants to save money, they've created a mobile euthanasia program. They have these vans that whiz around. I'm not quite sure how they work. I think you call, I read this in the UK Guardian, I think you call like 1-800-KILL-ME or something, and these things whiz around, and they come up to your front door and euthanize you. Now these guys don't know you from Adam. I don't even know if there's a doctor present. But they don't know whether you just stubbed your toe or you really have a terminal illness. And in the irony of the world, the people that are protesting this program the most are the German Hospice Association that says, we think this is an inhumane and unethical procedure. So anyway, I think you can't make this stuff up. Now, what's happening in America today with the Obamacare? Who are the architects of Obamacare? They're people that absolutely believe this kind of utilitarian ethic. They want to fairly redistribute the money. One of them is Ezekiel Emanuel. Ezekiel Emanuel is a brother of Rahm Emanuel, and he wrote an article in 2010 called The Disability Adjusted Life Year. Now this is a very chilling article. He and two other doctors, they wrote this in The Lancet. And of course he's an NIH doctor. He doesn't practice private medicine, and he can't wait. You could just read it between the lines. He can't wait till the government gets a hold of all the health care dollars. Then the question is, how do we fairly distribute it? So he's come up with a formula. It's called the Disability Adjusted Life Year. And this formula is supposed to determine whose life year is more valuable than the other person so that they can distribute the money. I don't know about you, but I find it, it shouldn't matter that he's Jewish. I mean, any doctor doing this, I'm disgusted, but it seems like a Jewish doctor would understand the history here a little bit, that's exactly how we got into the World War II problem of saying, gypsies are not as valuable as our, Germanic warfighters. And so to have an article that says we're going to distribute the money, and if you look at, there's a bell-shaped curve, and if you're under the age of 2, or like me, over the age of 60, you might as well just kiss your ass goodbye in the future, because that's why I wrote this book, because you're going to be on your own. They're not going to give any money to caring for people that are not in the middle of the tax base. When I was in Finland, I asked some lady that was our tour guide, I said, tell me about your medical system, and she said, she was like 55. She said, well, if you're young and you're pregnant, you'll probably get the care you need, but I'll probably die before I get it. And that's all government healthcare systems. Unfortunately, that's the sad truth. Now, the good news is there's hope on the horizon. And here's the hope on the horizon. The hope is that we have a lot of doctors dropping off this system. They're not taking third-party payment, because there's ways of doing this. And I actually have 3 articles I printed out. One of them is the 3 C's of healthcare. And, it talks about, this isn't brain surgery. This is really just going back to the way we were when we built the finest healthcare in the world. And it's basically the system we use for buying tomatoes. Why is it when you go into the grocery store, you know how much a tomato is going to cost, right? You can look at the sign. Why can't you do it in medicine? And I actually heard Trump had a 7-point plan on reforming healthcare, and he's right about 5 of the points, but one of them he's wrong about is transparency. He wants to force doctors and hospitals to have transparency, meaning to post your prices so people know when you go in. Why can't you know when you go in how much it costs? Well, I'll tell you why. Because no matter, in private practice, I can tell you, no matter how many contracts I signed, no matter how many agreements I made with the government or private insurance, I never knew when I was going to get paid. I never knew how much I was going to get paid, and I never knew when 2 years or 3 years down the road they were going to reach directly in my bank account and take the money back out and tell me we determined that care was not medically necessary. How can anybody run a business like that? Okay? Whereas when I go to buy tomatoes, I could choose to buy the expensive tomatoes at Whole Foods and know that I'm going to pretty much be assured of good quality. I can choose to have a cheaper tomato over at No Frills, and sometimes I have to take a risk it's not going to be good, but that's my choice. You don't have that choice in medicine. The best neurosurgeon, the worst neurosurgeon, it's all the same in the government system. Go to the VA, check it out, see if that's what you want for your health care. So there is hope, and the hope is a lot of doctors are starting to drop off this system. They're starting to work for cash. I actually have my little anti-aging concierge business, and I do that on the side, but I meet my patients sometimes at Starbucks, and for an hour, you pay for an hour, but you get an hour of actually one-on-one talking about your health care with a physician. What do you do when you pay to go into the system? Well, the first $65 or whatever you paid just paid for the billing costs. It's a nightmare. So you're not getting value for your dollar. That's what we really should be saying. It's interesting. So years ago, and I'm sorry he couldn't be here, by the way. Yuri Maltsev, was invited. He couldn't come. He's a great guy. He used to be the economic advisor for Gorbachev. He's a friend of mine. He's at the university. He's at Carthage College. And in speaking about healthcare, he has a great article, by the way, I highly recommend. It's on the Mises.org website, and it's about what we should have learned from Soviet healthcare or something like that. And he talks about this whole situation. But he had a very funny line at our meeting, and he said, you know, we have to get all this stuff straightened out because I can't afford to defect a second time. You know, it's like everywhere he goes, socialism follows him. You know? So here we are. You know, but there is an option. So people are starting to opt out, and they're starting to offer three things. The answer to the system is cash, catastrophic insurance, and charity, the 3 C's. And how does it work? When you pay cash for your outpatient items, then it really, you know what you're paying for. The doctor knows how much to charge. It keeps costs down, because if I charge $100 to inject a shoulder, but the guy down the street charges $50, you might choose to go down to him. So it keeps costs down. You know, it's interesting, the other little Russian vignette, I don't know if this is true or just apocryphal, but it's purported to have said that Stalin once said, wouldn't it be great if the whole world were communist? And his economic advisor said, no, Comrade Stalin, we need some free market country. And he says, why? And he says, well, because we need to know what the real costs of goods and services are. And that's true. See, we haven't had a free market. When they tell you the free market's failed, we haven't had a free market in medicine since 1964. Most people don't know what the real costs of goods and services are. So when you go into a standard physician, they can't give you a price. Now, if you live where I used to practice near the Mexican border, we kind of knew what the real cost of goods and services are, because you could go across the border when Medicare was paying $1,850 for an MRI. You could go across the border and get the same quality MRI for $350. That's the real cost, because of cash. So that's the real cost of goods and services, and that's about what these places are getting paid now. And same with medicine, same with everything. You know, the problem is overregulation. Well, when you have a cash system, an outpatient, you don't have to bill a third party. You're not under all this regulation. All that cost goes away. All that cost, it doesn't contribute to health care. Okay? The second thing is catastrophic insurance. Now, how does that work? I'm surprised when I give talks to medical students how few medical students really understand how insurance works. But this is just like your house, okay? The problem with healthcare today is we try and put everything under our insurance. We don't want to pay a dime out of our pocket. That's not the way insurance really works. An actuary cannot conceive of how many times you're going to get a runny nose and go into the doctor or go for well child care. What he can determine is how many times actuarially you're going to have a heart attack or a femur fracture or something that there's a big ticket item for. So real health insurance works like your house insurance. When you have a shingle blow off your house, you don't call the darn insurance agent, right? You reach into your own pocket, not your neighbor's, you take out the money, you buy a shingle and you put it up. When your roof blows off, you call the insurance agent. And that's what we used to call major medical. That's what we used to do before this whole system went to fluid. Okay? And that's what we need to go back to. The so-called high deductible, but you can choose the deductible. Bottom line is you pay for little outpatient items. It only kicks in for big ticket items. And then the cost, when people say, but how can you afford those outpatient items? The cost of all those go way down. Okay? That's the point. So that's the second thing. And then it has to be balanced by charity. For that 15%, you know, the difference is, of that 15% that didn't have insurance before, that we're always worried about, some of them are able to pay for it themselves. That's why they don't have insurance. The Bill Gates of this world, okay? Some of them are just going to take a gamble for a little while, and some of them, like my son, we thought he was insured, it turned out he wasn't for a year. They're passing through that stage. Most people are not there permanently. And for the few that really are disabled and poor and cannot take care of it, we used to be able to do charity, but we've priced ourselves out of the charity market. And I don't know if you know this, but if you're a Medicare accepting physician, you can't see people for free. That's discriminatory against Medicare. You can't go below Medicare rates even for the poor. How sad is that? So we need to get back to the old system of cash for outpatient. Now, but here's what's going to happen. Unfortunately, I'm here to tell you that there's two ways the world can go. There's two ways that medical care can go in America. The first way is the government can have this kind of Zen moment of enlightenment and say, oh my gosh, we were wrong, government medicine doesn't work, let's go back to the cash, catastrophic insurance and charity that we used to do before 96. What's the chance of that? Okay, so what's happening really is they're realizing that doctors are dropping off, that patients are dropping off, and you can't keep a system that is run by force to begin with operating when people find a free market way of doing it. You just can't. So you have to force everybody in. The Soviet Union had lousy, if you read Maltsev's article, there were dead cats lying in the halls, nobody had quality health care because it was all in all the time. Every doctor, every patient, no exceptions. That's the way. It wasn't like they excluded people from the good stuff. They just pushed everybody into the same lousy system. And that's what really they're trying to do here. So the way they're going to do it, and this is your actionable item, as citizens of Nebraska, if you want to preserve your freedom to choose how you get your health care, here's what you have to do. Medical care, physicians are licensed under your state medical boards. And as historically, under states' rights, each medical board acted independently. Well, the government doesn't like that because you see, as doctors drop off the grid and start doing cash practices, they don't have control over them. Well, to seek to get that control back, what they're doing is they're going to try to round in these state medical boards and tell these state medical boards, if you don't tell your doctors they have to take Medicare, Medicaid, Obamacare, and any other fly-by-night stupid system we send them for whatever we want to pay them, then you can't give them a medical license. Okay? Just like 1942. If you don't play in our ballpark, if you don't participate under our rules, we won't give you a medical license. And the way they're doing it, they're creating they've created the Federation of State Medical Boards. What a nice name. And what that is an umbrella organization that then will be able to pressure the state medical boards. So you guys, if the death of medicine is when, you may think that you don't have anything to do with your state medical board, that why would I be concerned? But if you pay attention, the state medical board is where is the linchpin. This is like a helicopter, it has all these moving parts. And right now, you see these helicopters flying, you don't see there's any problem. But what's happening is that little rotary bearing just below the rotor, if that goes, the whole thing crashes. And what that rotary bearing is right now is your Nebraska State Medical Board, of which I'm a member. So, I mean, I'm not on the board, I'm a physician in Nebraska. So, I really urge you to pay attention to them, and when they start saying to have when they want to put out that you have to have a license under these conditions, you need to say no. People need to stand up and say, no, we want to be able to contract however we want to with our doctor. That's the answer. So, I want to leave you with this. I said, there's a 1946 quote by George Orwell that, quote, political language is designed to make lies truthful and murder respectable. That's what countries do. Whether you're talking about the Liverpool pathway, the Soviets using doctors to imprison Andrei Sakharov and other dissidents because of psychiatric reasons, or the Germans murdering people with their physicians. We're here to preserve life. We're not here to kill you. We shouldn't be here to kill you, but if you put us in that position, we do know how to do it. And that's the problem. And here, and this was I just happened to see this the other day. This is from the Sunday Des Moines Register about a week and a half ago. It's not as important apparently as Iowa basketball, but it says, exit plan for terminally ill. And there's one of those, words to make it sound acceptable. Exit plan. It sounds kind of benign, doesn't it? Exit plan for terminally ill. Thank you very much. I guess they've actually given me some time for questions. Sure.
When I lived in California, I worked with medical records. I had to pick up medical records. It got to the point, I guess by about 2008, where easily a third of the doctor's offices that I went to had a sign on the front door that said, as of such and such date, we will no longer take any Medi-Cal patients.
Right.
And I saw those signs more often. So finally, I'm at the doctor's office, and I asked one of the doctors, why is it that so many people aren't? He said, I might get paid in 6 weeks, I might get paid in 6 months, or I might not get paid at all. And he said, I had to hire a full-time employee
just to
do nothing but handle my Medi-Cal paperwork.
That's exactly right. And at the end of the day, they'll get paid $9 for something that cost them $100 to produce.
Yeah, that's
so
what
it's,
he said.
in Arizona, we lived right across the border, and people used to ask me, what's worse? Are you worried about living on the border? And I said, yeah, the border with California. Is that the one you're talking about? Because the way that they balanced their budget partially was they would let California Medicare patients, Medi-Cal patients, come over to our hospital, to our clinics, and they never in 20 years paid a dime. We just did it for free. Now you can't, everybody wants to say, well, you know, doctors, oh, you get overpaid and blah, blah, blah. But the bottom line is there's a real cost of goods and services. It's simply not worth it to practice medicine and not be able to feed your family. And don't think, about 50% of the physicians' offices, the big groups now in California, are on the verge of bankruptcy. It's not, most, you know, I have a friend who's a general surgeon, he and his dad, they've been in practice together, both general surgeons, for over 30 years, and they just closed their office because they could not deal with the electronic medical record requirement. They could not afford it. So now they're working for a hospital. And I just know, private practice is collapsing. I'm a perfect example. I should still be in private practice, I'm not. And so, in fact, my friend Jake back there, he and I are actually running a cash pay tattoo removal service, latest state-of-the-art laser, if anybody needs a tattoo on. But it's cash pay, because we need to do something to get out from underneath this. Yeah, and it's terrible. I mean, and it's worse than charity. Now, if you want to know how charity should be done, I have a friend, the Association of American Physicians and Surgeons. We are kind of the repository for cash doctors. And one of our former presidents is Lita Eck. And if you go to our website, aapsonline.org, you can learn a lot about Dr. Eck and her husband are physicians that have the Zerapath Health Clinic in New Jersey. And they've actually shown that, you know, Christie and the people in New Jersey, that they can do charity cheaper than the Medicare. And it's appreciated. Their patients know that they're doing it out of charity. And it's like, it costs $5 a visit. They have patients volunteer to be the help in the clinic. It's a wonderful system. And that's what we used to always do. We had charity hospitals, charity clinics. It was run by religious organizations and your local counties. It was not run by the federal government that can't do charity.
Experience, but do you find, I see a lot of people that are for euthanasia and expanding Medicare. Do you think they're just ignorant or malicious?
Well, I think, see, look how euthanasia has been portrayed. It's been portrayed as, oh, those terrible doctors don't want you to be out of pain, they want you to suffer, you know, or that we shouldn't have to have terminally ill people suffer. There's a point to that, okay? I do understand that. I mean, I think if you're in pain, you certainly should have first of all, if you're successful, who's going to prosecute you? I mean, it's your body. You should be able to off yourself if you want to.
Can you have that system ever if the government's going to be involved at all?
But you don't want the government to be doing it.
So you can't have euthanasia as long as the government's involved with healthcare, I guess.
Because you don't want them to be making the decision. Unfortunately, it becomes involuntary euthanasia. It always does. Or it becomes, you know, first it's death by omission, and then it's death by commission. You know, it's kind of like, you know, and we have this in a lot of different ways. The FDA, we know about a lot of great things, but the FDA won't pass it. That's death by omission. Because of a lot of different reasons. But there's a lot of ways that we can kill people by omission, and people are not aware, you know. So, you know, should we have a system where, you know, you should be able, you know, in a free world, let's say this, in a free world, maybe it's okay to have a nurse that, that doesn't take the Hippocratic Oath, but has a different role in life. She's a euthanasia nurse, like we have midwives. And maybe you should just be able to go and have her off you. I mean, I'm not opposed to that per se. What I'm opposed to is the government running it, because I don't trust this. It's like we already have them, you know, killing people that they claim were convicted of murder that were innocent, and we don't need them killing us. And trust me, it's not just, I try to tell this to my Republican colleagues and my religious colleagues, that it's not just about the unborn. Government, big government, kills everybody from birth to death. I mean, they are non-discriminatory in a lot of ways. They just want your tax money. They want your body.
There was a euthanasia bill this last legislature, and Ernie Chambers was for it. And I would love for some senator to stand up and ask him why he wanted to kill black people.
Really? I know you have to, that's a fair question. It's a fair question that you should ask. I mean, especially of Ernie. But there's a poster child for government run amok. But yeah, no, I mean, the issue is, and let me tell you the slippery ethical slope when you put doctors in this pathway, okay? Now my son graduated from Creighton Medical School. I'm going to pick on Creighton a little bit. And I have a long history with Creighton, but Creighton Medical School has a graduation ceremony for their medical doctors. And he's just graduated, and my husband and I were sitting in the audience, and they said, we're going to take the physician's oath now. If there are any physicians in the audience that want to stand up and take the oath along with these students, do so. I saw one guy stand up. I didn't stand up. My husband nudged me, and I said, I'm standing up. First of all, this is not really the Hippocratic Oath anymore. But second of all, these guys are, every one of these, I can guarantee you, every one of these guys is going to violate this oath within 30 days. And he kind of looked at me, and then later, when my son we were having cocktails or something, I said, so you took this oath, and one of the things you said in the oath, which is that Hippocrates did believe in, was privacy. That I should not reveal your private medical life to other people. That's a very big deal in medicine. You should be able to tell me things and know it's not going anywhere. Well, but come July 1st, and so Nate's kind of looking at me, and I said, come July 1st, you're going to go over to your general surgery residency, and you're going to take every patient's most private stuff, their psychiatric histories, whether they have violent tendencies, or they just take antidepressant drugs or whatever, and what their weight is, and you're going to put it into an electronic medical record that gets blipped up to the universe to some unelected government bureaucrat who didn't take an oath to anybody's patient privacy. It's a total violation. If you want to be private, if you want to keep your information private, you need to go to a cash-pay private doctor that doesn't use the electronic medical system. Now look what's happening, and look what's happening in California. And this is right out of the Soviet playbook. They're using your psychiatric history to take away your Second Amendment rights. And they've even convinced, let's see, what's his name, LaPierre, the head of the NRA. Yeah, okay. They've even convinced him it makes sense. They got him to say, because again, they come at you in a funny way. They say, there's words, it's using words to mean something else. They say, now, Wayne, of course you don't want crazy people to have guns, do you? Well, but the little subtext is, and we're going to tell you who's crazy. That's the problem. Okay? No, I'll take my chances with a few crazy people getting a hold of guns versus the government telling us we all have to get rid of them. And here's what they're doing in California today. If you've had a history of being committed or hospitalized for a psychiatric reason, you lose, and everyone in your household loses your gun rights. And now what they're doing is they're actually, since they let a lot of people get off of that, they're going back and they're looking at these medical records and going back in time, and then they're going confiscating weapons. That's a very dangerous thing, and that's what's coming to our town if we don't stand up against it. So you don't want, personally, and I have it in my book, which, we love, you can get off Amazon. I meant to bring some for sale, and I blew that, but you can get off Amazon or WND Superstore. I'll put that little plug in. But one of the things I tell you to do is to keep your own simple medical record, because these electronic medical records are false, they're wrong, there are more errors in them, they kill people. I mean, we know about many deaths coming from electronic medical records. Any other questions? Yes.
Okay, so I worked in a pharmacy for a couple months, and if we went back to like cash only, how do you think that would affect the cost of medication?
Oh, well, it'd be great, because here's the thing. Drug companies price, just like anything else. Theoretically, in a free market, how do you do prices? In my tattoo removal service, how do we come up with prices? Well, there's kind of a standard idea we have of what it should cost, and then you do what the market will bear. You want to make as much money out of this as you possibly can, and you ratchet down the price until you're selling the product. If they couldn't, but the government, the pharmaceutical industry is now an arm of unfortunately the term is we have a fascist economy. It's a public-private partnership where the government is being used to force you to buy these pharmaceutical companies' drugs. I used to stand up for the pharmaceutical companies, but they're an evil enterprise. But basically, if they couldn't, right now they may, because of these third-party payers, and patients don't have to bear the burden, they can charge $120 a month for metformin. Okay, but when patients have to pay, they couldn't get away with that. They charge less, and they would pressure. Then they wouldn't pressure the government. I mean, they would pressure the government to not make it so onerous to get a drug to market. I mean, the FDA claims they're making us safer. It takes them 15 years to get a drug to market. So every time they say 35,000 people this year are being saved, we passed this new cardiac drug. Just keep in mind that took 15 years. It should have only taken 1 or 2. So the prices are artificially inflated in pharmaceuticals because of government, not, as Ronald Reagan said, when government's a problem, more government's not the answer. But when we go to a cash practice, trust me, the prices will go down. Yes, back there.
When it comes to the cash part, do you do Bitcoin?
You know, I would love to do Bitcoin. I tried to do Bitcoin on my website when I was a candidate. I couldn't make it work. When someone
Just a basic wallet. It's easy to set.
Yeah, I tried that. I mean, it's not as easy as it sounds. I wish we had a way of doing it, but I don't have a way of doing it. And it's also complicated because somehow you have to arrange it. You got to pay taxes, and I'm not quite sure how to deal with all that. But if you want to tell me later how to do it simply, I'd be interested. But yeah, I don't know how to do that. So right now, we take that green stuff and we take credit cards.
Yeah.
Yes, sir.
I'm sure you're well aware of the Oklahoma Surgery Center that does
Absolutely.
cash.
He's a friend of mine.
And there's actually a few of those centers starting to sprout out. Do you see that becoming a new trend based on obviously what we're dealing with right now? And if so, if it does become more and more popular, can you see the government stepping in and trying to
Absolutely,
regulate?
that's the problem. I mean, I love what Keith Smith has done down in Oklahoma, and he's actually an AAPS member. He's given us a lot of talks about this, basically, and a bunch of doctors, same thing. They post their prices, and they
Let the
run
market
for
work.
cash. He treats people at the surgery center in Oklahoma for less sometimes than Medicare, sometimes more, but certainly less than the local hospital that's under Medicare regulation. When I was doing spine surgery all the time, the Blue Cross was paying for a single level anterior cervical discectomy. They were paying the hospital for the total bill, not my bill. The hospital bill was like $17,000. We showed them that we could do it in an outpatient surgery center, even taking the Blue Cross, for $11,000, and they wouldn't do it.
Right.
So why? It's because this is not, there's a huge conglomerate collusion here to shore out the hospitals and the Blue Cross people, and they're all in this together, and they don't really, cost effectiveness is not as a big a deal, because the government can tax you to death, and Blue Cross can just keep raising your rates.
Because I seen his story on John Stossel's show,
Yeah.
and he actually said that when they went and posted their prices, the local hospitals were forced to lower their prices.
Right, and that's what competition,
Yeah,
that's what cash does to
exactly.
competition.
Yeah.
But yeah, you're right, the problem is that if you take the flyer, we set up a surgery center, a private surgery center, but we didn't take Medicare and everything. But there were 8 of us that contributed money, and I raised the question, this is years ago, I said, how do we know that tomorrow Medicare won't change the rules in order to make us non-viable? And that's exactly what happened. So yeah, they can unfortunately, see, he went through like Medicare certification but doesn't take it. So he can claim he's got the same level of sanitation and all the different things, but he does take cash, and he's doing very well. People from all over the world and all over in Canada and all over America come. And he can, people, instead of paying $40,000 for a total joint, they can do it for, less than 12. So it's a great idea, but yeah, and the problem is people need to stand up. People need to say, and states need to stand up. We're not going to take down the federal government in general maybe, but what we have to do is a states' rights issue. This is like education. I ran the numbers in education. The money we get from the federal government doesn't make up for the money we send in. We'd be better off doing our own education system, not taking any federal funds, any state funds, just do it locally like we used to. Same thing with medical care. What they're going to do is they're going to pressure the state medical boards and say, if you have these private hospitals, if you have these private doctors that don't take anything but cash, we're not going to give you any federal funds. And what the state of Nebraska needs to realize is they'd be better off without federal funds.
Exactly.
It would cost them less to run the hospital. I have a thing from the University of Iowa hospitals, and it showed that an appendectomy in like 1920 or something, 1925, was $105. It was not that expensive relative to a blue-collar worker's wages in those days. Now it's out of sight for white-collar worker wages. I mean, it's just gotten completely out of sight. It's just like everything else. There's several graphs that you can see. One is, in the world, is GDP is flat, but the growth of derivatives is like that. And Medicare is flat, or medical care is flat, but the growth of paperwork and all the stuff keeps going up. I mean, it's happening everywhere. And so yeah, we would be better off without those federal funds, and you need to tell your legislators that. I'll tell you one of the things we're fighting right now, and the Libertarian Party has stood up and taken a side on this, is mandatory vaccination. And people can say whatever they want. I had the ACLU gal came and spoke at our convention, and I asked her the question, I said, why aren't you standing up for people who don't want to be involuntarily vaccinated? Oh, we decided not to get involved in that fight because they've convinced everybody that if you don't believe in mandatory vaccination, you're crazy. Well, let me tell you, I've actually, when I talk to people about vaccination, I don't talk to very many people that have actually, in fact, nobody if I ever talk to, that have actually read the scientific studies. I've read the scientific studies. And this is not only crazy scientifically, but as libertarians, we should understand that if you give your if you say it's okay for the government to inject whatever substance they claim is safe into your body, you have no freedom left. That is the Rubicon, in my opinion. And that's coming to here too. And you guys, Nebraska, go Nebraska, you guys stood up against it. This latest one is the meningococcal vaccine, which in Iowa wouldn't have saved one life last year and is going to give every year the pharmaceutical companies over $6.5 million. Every year. Who profits? Cui bono. You know, it's not your kids, not your families. You know, even the CDC doesn't recommend mass vaccination against meningococcal vaccine. It's only the pharmaceutical companies. And if you look in your state and on our state too, the Pfizer company is lavishing money around to all these things, and then the guys are saying, "Oh, no, we don't get that. Doesn't sway us, really. Why do you think they're spending this money on you guys?" You know, Linda Upmeyer, one of the, I think the Speaker of the House or whatever she is, she's the person that controls the access to the bills, whether the bill comes out on the floor. She got $3,000 from Pfizer. What did they expect to get for that? Access. You know, don't tell me you can't be bought. They don't see the problem. Well, anyway, thank you very much.